In this video, we're talking tinnitus, or ringing in the ear. I'm going to show you how you may be able to reduce or improve that ringing in your ear sound. Stay tuned. Thanks for tuning in again. My name is Dr. Jon Saunders. If you're new to the channel, this channel is for those people that want to take an ownership in their health and recovery. If you're the type of person that loves to take ownership in your health, please hit the subscribe button below and the notification bell so you can be informed when I upload a new video. Today we're talking about tinnitus, ringing in the ear. Tinnitus has many different causes. I encourage you to speak to your healthcare provider to ensure that your tinnitus is not something serious. The most common causes of tinnitus are age-related hearing loss and exposure to loud music or loud sounds over a long period of time. Other causes could include ear infection, a wax buildup, medication use. Things like antibiotics and certain anti-inflammatories can cause that tinnitus or ringing in the ears. Certain neurological conditions can also cause tinnitus or ringing in the ear. And very infrequently, it could be a sinister cause that needs medical attention. Certain types of ringing in the ear or tinnitus can be associated with an upper cervical spine dysfunction or disorder. We call that cervical tinnitus, cervicogenic tinnitus, or somatic tinnitus. Not unlike when someone suffers from cervicogenic headaches or cervicogenic dizziness. Some of the cause is typically in the upper neck. With that in mind, some of the tips I'm going to give you momentarily are going to address that very cause. Researchers believe this connection exists with tinnitus because of the upper cervical mesh and the multi-synaptic connections between the upper neck, the brainstem, and the cochlear region in the inner ear. So the three things I'm going to show you to help address your tinnitus and hopefully help reduce it is going to interplay between those three regions. So most likely those that are going to find some relief from these movements are going to have a connection with their tinnitus to their upper neck. And even if you're unsure if these movements will help you because you're unsure if some of your tinnitus might be coming from your upper neck, it will not hurt to try. There's just no guarantees, but I do suggest you give them an attempt. The first movement I'm going to show you involves range of motion in your neck. Now, I don't suffer from chronic tinnitus, but I do experience tinnitus or ringing in the ear from time to time, and I find this helps manage and get rid of my own tinnitus. I want you to try to be specific here, and what I mean by that is I want you to become aware of your body mechanics. I want you to become aware of how balanced you are from side to side. So we're going to test your cervical range of motion in all ranges. First, we're going to look at your rotation. And what I want you to note is when you move side to side, do you feel restricted one way or you can't quite go as far on one side? Note that. Then we're going to do lateral flexion. So this one for me, I definitely have restriction in lateral flexion. I think that this is why I get some relief when I do get tinnitus occasionally. So again, really focus and try to visualize or really understand where your restriction is. When I go to my right, I feel more restricted than I do to my left. So I'm going to note that. And then finally, we're going to look at flexion and extension. For some of you, it might help to actually do this in the mirror so you can actually see it, but you should be able to sense which way has more freedom of motion. For some of you, it might be both ways or in all ranges. So what we're going to do is we're going to focus on the range of motion that was limited. So for me, it was right lateral flexion. So for me, I'm going to start with an isometric contraction in the same way. Hold it for 10 to 15 seconds. And then you're going to release, and then you're going to stretch into that direction. And you're going to hold this for 20 to 30 seconds. Now, if you were restricted on both sides, you do both sides. If you were restricted in rotation to the right, we're going to do the same thing. We're going to rotate right isometrically, hold for about 10 to 15, and then we will stretch into that restricted side. You might feel some tension. Push into that and hold the stretch for 20 to 30 seconds. Now, if you are on both sides, you do the same thing on the opposite side. So we're going to rotate to our left rotation. 10 to 15 second hold, and then we're going to stretch into that range of motion, 10 to 20 second hold. Do this 2 to 3 times every day. The same thing if you're flexion or extension. If you're restricted into extension and you can't quite go back, then you're going to take your hands on the back of your head, do an isometric contraction, push back 10 to 15 seconds, and then release, and then try to push into this. Now, if you experience any severe pain, any dizziness, any strange symptoms, you need to stop this and speak to your health provider to make sure this is okay for you. This, for myself personally, works almost immediately to reduce my periodic tinnitus. This second way I'm going to try to help you reduce or eliminate your tinnitus is using trigger points. There's 2 main areas I want you to focus on for the purposes of this video. One of the areas that I want you to focus on is your suboccipital region. We've spoken about this in other videos, but I want you to take your fingers, I want you to take them and drop them off the back of your skull and just palpate around the upper area for some trigger points. When you find them, I want you to compress them. They'll elicit some discomfort, but hold them until that discomfort diminishes. This is something that can be done a few times a day, every day as well. Another thing that works for treating your suboccipitals is tapping. And so what we want to do, we want to take our hands on the back of our skull and we want to tap with our fingers like this. I know that looks and probably sounds strange, but I believe it works just like a trigger point by helping reduce the suboccipital muscle tension. The good thing about these can help with cervicogenic headaches and cervicogenic dizziness at the same time. The other area we want to focus on is around the TMJ joint or the jaw joint. This muscle right here called your masseter, it is the main muscle that we use when we either chew or we bear down because we're stressed, we clench. This tightens, and this has been shown to impact tinnitus as well. So what we want to do, we want to clench down, find the belly of the muscle, and we just want to follow our jawline and kind of up a little bit and just find if we can see and feel any trigger points. When you find 1 or 2 on both sides or on one side, just gently press. This, you're not going to have to press too hard. It is a very sensitive area. So just compress that until you feel the tenderness reduce. A great way to follow up to really get to the muscles of mastication as well as the TMJ joint is just to stretch the joint. And how we're going to do this today is we're going to open our jaw and place our chin here. We're going to open as wide as we can. And we want to push down, causing our jaw to stretch open. We're going to hold this for 20 to 30 seconds. And then finally, one other thing you can try. This seems a bit unusual, but I still encourage you to try it. It is going to be what we call an ear adjustment or ear pulls or tugs. You're going to take a pincher grasp and we're going to actually take the inside of our ear and our lobes and we're going to just pull down. So you can do both at one time or you can do singles. But what we want to do is we want to pull down and then up. And so you don't want to pull your ears off. You want to be very gentle. You want your fingers to slip off, but you do want to get some movement. Some people will like to grab their earlobes. I like to get inside the canal a little bit, and we're just going to pull down and then up. Why I think this helps some patients with tinnitus is because what happens, it starts to move the ear canal, so it can break up any wax buildup. It can change the angle. It can allow the ears to drain. It also helps open up the eustachian tubes that drain into the back of your throat. Sometimes if there's pressure buildup, this can cause a ring in the ear, a dizziness, a fullness in the ears. So this actually works really well. You might even feel a little bit of a click when this happens. Again, don't overdo it, but you can actually just massage around and flick up. If you'd like to delve a little bit further into some trigger points in your SCM, we got a great video here. Watch that, apply some of the techniques. That might just help with your tinnitus as well. We have a TMJ routine that I show you how to really work some of the extra muscles in your TMJ joint. This could give you the relief you'd like as well. Thanks for tuning in. If you liked the video, please give it the thumbs up. And again, if you haven't subscribed, please hit the subscribe button below and the notification bell so you can be informed when we upload a new video. I appreciate you tuning in. I can't wait to see you on my next video. And until then, stay well.